Are your orthotics really built for you? Orthotics are created primarily for improving your movement, but current orthotics are not built on how you move, which reduces the intended purpose by limiting the comfort, support, and performance where you need it the most while moving. This has a negative impact on compliance and therefore outcomes. But how are they actually built today? Today, we rely on shaping your orthotic to your feet's shape while standing or sitting, rather than designing it based on how to improve your movement. No orthotics today are built from real-life dynamic movement analysis, because until now, the technology didn't exist. Introducing MoveScan, the first orthotic solution engineered for how you move, powered by advanced sensors and AI that capture and analyze your natural movement in real time. How it works is simple. Scan your patient's foot with our mobile 3D static scanner. Insert MoveScan-enabled insoles into their shoes and let them walk. Start the analysis via our intuitive app. Clinicians instantly receive a detailed diagnostic report on the patient gait profile. The system combines a 3D static scanner with dynamic gait analysis to recommend custom 3D printed orthotics shipped directly to the patient. From capturing foot structure to delivering tailor-made orthotics, it's a complete AI-driven orthotic solution in under 5 minutes. It's time to stop prescribing orthotics based on how people stand and start prescribing based on how they move. This is MoveScan by Ballaston Health, where science meets motion.